Hello, and welcome to the Future of Caregiving, where we talk with experts, care providers, and those with firsthand experience to understand the rapidly evolving world of care. From technological advancements to demographic shifts, we'll delve into the challenges and opportunities that lie ahead for those who provide care and those who receive it. Join us as we examine the trends, breakthroughs, and innovative solutions that are shaping the way we care for each other now and in the years to come. So today I'm excited to introduce our guest, Dr. Janisha Hennigan. Janisha is a leader in the world of aging care and advocacy. After receiving her doctorate in physical therapy, Janisha had a successful 15-year career as a physical therapist across numerous healthcare systems. Mid-career, she went back to school to pursue a master's in public health. She now serves as the assistant director of the Agency on Aging in North Carolina Triangle J Council of Governments. Here she uses her expertise to support citizens that are aging adults, adults living with disabilities, and their family caregivers. We're so excited to learn from Janisha's knowledge and experience. So, Janisha, for our listeners, can you please give us a brief background about yourself? What inspired you to pursue your career in physical therapy and then make a shift to public health and the Agency of Aging?
Sure, Neil. Started out physical therapy, probably like most people, wanted to get into sports and things like that. But I noticed I had a natural calling to the geriatric population. I did some outpatient, but mostly I found more joy and even in the outpatient setting, working with those who had Medicare and things like that. And then I transitioned to like skilled nursing facility, which I absolutely love. But being in that setting, it opened my eyes to a lot of things. So, yes, it's physical therapy, but what about the entire person? So, it made me look at some of the social barriers that were preventing people to transition out of the facility. So, yes, I can help them ambulate and get them on their feet, but when they go home, do they have access to healthy foods to help them not be readmitted back to the hospital? Do they have transportation to get to appointments after they leave the facility? So, it's just all of those things made me look at the entire person, and some of those, as we know, are called like the social drivers of health that kind of made me a little bit more interested. I always had an interest of going back to get a master's in public health. I knew that when I was in PT school. So I just decided, hey, the world of healthcare and therapy was shifting in itself. And so how can I branch out? How can I, hopefully help with those who are trying to what we call care transition from home. I don't believe necessarily into institutionalization all the time is the answer. So how can we help people leave a facility, whether it's for rehab, not stay there long term, and those who have desire to live back into the community, how can we support them to do that?
That's great. That's great. Thanks for sharing. And it's really interesting and inspirational of how you can start your career in one place and then be inspired to shift focus and then help people that you were previously helping in a new career. And I guess that's a great transition point for many of our listeners may not be fully aware of the Area Agency on Aging and what y'all do. So can you tell us a little bit in terms of like what does the Agency on Aging do? How are these organizations? How do they come about? What is your role? And maybe even just give a snapshot of what's your day-to-day work like.
Okay, I'm with Triangle J Area Agency on Aging, and so we cover 7 counties closer here, so Raleigh, Durham, Orange County, and those the counties like closer more to this part of North Carolina. But there are 16 area agency on agings throughout the state of North Carolina, and so one of the things is we try to create partnerships as much as we can with our local providers to make sure that we're leveraging like quality continuum of care type programs and services. So it supports the older adults with disability, and also supports the caregivers as well. So mostly we do like monitoring of the older American Acts funds that go out to support programs like in-home aid, some of the home delivered programs and things like that. So we kind of provide technical support mostly for our local providers with that funding. But here at Triangle J, I kind of oversee kind of a multitude of things. So I supervise 2 programs, which started during the COVID time because of a caregiving issue. So we have two counties that decided to start programs that we call consumer directed programs. They were having trouble during the pandemic getting like in-home aides coming in home and also fearful, right? And so now they can hire a family member or someone they know to come in and to assist their loved one with care. So it's someone they trust with. So we have two programs that we started, like I said, during the pandemic, and that I oversee that. And I also see one for the veterans program as well, which is pretty much the same thing. It is with the veteran administration, but the veteran can hire a caregiver to come into their home. It could be a family member, and that person provides care. They train them. They're the employer, and it's an employee type relationship. So they're all consumer directed. The individual is driving the service or their designated representative. And then some of the other things is just facilitating partnerships, again, collaborating with other organizations in Wake County and Durham County as well. But that's what I do here at the Area Agency on Aging.
That's great to hear, Janisha. Thanks for sharing. And I think if many of our listeners may not even be aware of these programs, so really good to build public awareness. And if y'all are in need of care help, definitely check out these programs. I think as a follow up to that, would love to learn, how did you guys decide, to kind of implement these programs? That from your experience, what are the challenges you see with families you serve when they need care help? Are there challenges to affordability, access, to finding help? And then, kind of like what are some of the consequences that you see when people can't find it? And then you could talk about it at more of a structural, systemic level, as well as if you have any kind of personal anecdotes of families that you've talked to over the years and just kind of seeing the challenges. I think it'd be helpful for you to describe for our listeners.
Yeah, I think you kind of hit it right there. So like I said, mentioned those two programs that we started. So one is in Johnson County, one is in Chatham County. And so those two counties, local providers decided to use that. And like I mentioned before, during the pandemic, and I think the pandemic probably tore the Band-Aid off or made it illuminated a little bit more. I think we knew these issues were already here, but how seriously did we take them? And I think the pandemic, when the world had to shut down, who's coming to help you take care of mom or grandmother who has dementia and things like that? So some of the care workers, they left the field because it became stressful during the pandemic, right? It's like health wise for everybody. And then also those who lived in the homes, they didn't want anyone coming in. So there was already a shortage of of care aides already. And like I said, I think the pandemic just put the spotlight tenfold on the issues that many people have been talking about for a while. I think these issues, when you say the baby boomers, and I think maybe it was just a great moniker and just things to say, but I think the reality of where we are is showing like we need to have support for care and our caregivers. So I'm glad these two counties decided to use funds that we got during the pandemic. Some of those disaster relief funds kind of help start those programs up. It's not big. It doesn't replace salaries and things like that, which is a whole nother issue in caregiving, right? Family members have to, if they're the ones providing care, they're losing work time. They're losing, their whole productivity in their workspace to take care of a loved one. And so no, that doesn't cover the loss of a salary, but it does help give like some respite, some relief, just someone coming in to kind of help a family member. And I think the Veteran Administration had already saw this. This program started even before COVID, and it's, throughout the United States. But I think it is showing, even for our veterans, the importance of having, care at home. But the issue is, where are we going to find these care workers to come in the home? Because even in the program, we've had some clients who didn't have a family member to help out. So we try to help them, give them the tools to go find someone to hire. That was a very hard process. Like I had one client that went months and could not find anyone. We thought about going to like the schools with the nursing schools and things like that. So then some of the issues that came up, which is pay, right? So undervalued career, being working as a personal care assistant, it can be undervalued. And then, like I said, during this time we're having in the past 3 years, wages, people want to get paid for what they do and because they have to live. And as we see, the cost of living has definitely gone up, especially being here in the Triangle. So it was hard for people to find someone who was willing for the pay because it's not a lot, right? And so definitely trying to find caregivers that were willing to work for, the hours and the pay has been hard. And I think that's the thing we have to look out, making sure, you know, aides and things are being paid equitably, that they need a way to live, right, as well. But then there's also the issue of there's those either you can afford a private pay person, you have the means and the funds to do that. And then there's those who may be able to qualify for some assistance programs like through Medicaid, but then there's those in the middle. And it's like they don't have they make enough, they're living, right? And they're trying to survive, but they need a little bit of help and they don't qualify for any They can't pay someone $30 an hour to come in, even if it's only 3 hours in a day, right? That stuff starts to add up. And then, but they don't qualify for some of the other programs. So they're kind of just stuck here in the middle. And I will say of late, I've been helping with our toll-free line, and a lot of our calls lately have been caregivers trying to figure out what to do, right? Because they're in this, those that are in the middle, right? Like
Wow.
what
And yeah, and to follow up to that, I'm curious. We had read that the number of people in this middle is very high. I think that we were doing some research with the UNC Gillings School of Public Health, and they had suggested that 80% of people were in this kind of middle zone that, didn't have the subsidized care help and then could not afford the prevailing kind of agency structure with the $30 an hour of care. So I think, what was surprising to us is that because it's one thing to talk about research, but it's another thing where you're talking to the families directly. What do you find is happening with these families that are kind of stuck in the middle, can't afford? Are they just doing it themselves? Are the spouse or the son or daughter just kind of like leaving their job to do it? Are people not getting care? Are there hospitalizations and, kind of like health outcomes that are worse? Just kind of, yeah, what are some of the things you've heard or seen?
Yeah, definitely a mixture. So we've had some family members have left work to try to stay home. Hopefully, if they have like a spouse or somewhere and they're just trying to, if the daughter has to stay home. And as we know, probably statistically, it's more women who are being the caregiver, right? So whether that's for kids or a parent. And so leaving work to try to take care of a family member. I just remember one call, she's like, I've missed so much work trying to get my mom to the doctor, trying to get this, or my mom was just hospitalized. She's about to leave rehab and we don't know what to do. The mom has too many assets. So it's like, can't necessarily put her in like, she's not necessarily skilled nursing level, but we don't have what we need for in the home. And the burnout for caregivers, I think in the past, this month, or in the past, since the beginning of the year, having to answer phones, caregiver burnout is truly a thing. I know we say it, but just listening to some of the calls and people don't know what to do. I had a caller, her husband's in his 60s with dementia. And she even said, he's probably going to live a good while, right? And because we have advances, we're thankful for medical advances and medications, but we have people who are being diagnosed earlier with dementia in their 60s. They're probably still going to live X amount of years later. Who's helping take care? That's a lot of years to take care of someone who's progressively going to decline, right? Who's going to need more care. So where they may be, for some caregivers, they're like managing because their person is still ambulatory, their loved one is still able to move around, they can get them out the home. But as some of them are trying to plan, and as life takes its course and decline, and people want to keep their family members at home, everyone makes the promises, I try not to I don't want my mom to be in a nursing home and things like that. And that's totally understandable. Everyone should have the dignity and the choice to be in their home if that's where they choose to be for the quality of life. Um, but, as people become more frail, people are living longer, you know, our frail population, 80 years plus years old, they're still, some still active, but some are still frail, more medical needs. Who's going to help take care of those individuals? And if there's no one to take care of them, I think goes back to your other thing, some of the repercussions of we have more falls. So falls lead to, if there's any broken bone or anything like that, especially for women, the decline in health increases dramatically. And so that's requiring more assistance, right? Or as they get older, like, how are we making sure that they're taking medications and that they're not having like polypharmacy type issues, right? Of different types of medication interactions because there's no one there to really check on them. If your daughter sets the pills out, how we're making sure because she has to work, mom's taking the right dosage of pills and things. And so we know that a lot of hospital readmissions or people having medication interaction, especially older adults. So, if we can, it just helps overall if we have people, people have, what they need, access to caregivers. But that comes with what? Funding, right? And so for those programs, even those programs where people may qualify for, if now we're talking about we need to pay our care aides more, but we're not increasing the funding, that's less money to help more people because you got to pay people more, right? So how we have to address even, and that thinks that's where we maybe get on a policy level, on a federal and state level, like we need to put funding into our caregiver type programs where people can have access to care. We're in an aging nation. North Carolina is what, like, is going to be like eighth for 60 plus, and then by 2030 or 2038, like 95 counties will have someone, the largest population of 65 and older. That's a lot of people.
Wow,
So
that is a
what
lot
are
of
we
people.
doing? What are we
Yeah.
doing to, and not just, so if you live in, let's say Raleigh, you live in Durham, or more metro areas where there may be even a little bit more accessibility to care aids. But what if you live out in the rural parts of Orange County or Lee County where there may not be? So how do we make sure that those even in our rural counties are having access to,
Yeah.
care, so at least assistance for caregivers or some type of care aids to help them out.
And I think one interesting thing that you mentioned was your comment about how it disproportionately affects certain people, and we've kind of also seeing this in the statistics that disproportionately the care burden affects women, especially working women who are in the middle of their career. It also disproportionately affects people of color. Lack of affordable access to care and other supports that they may not get from their employer. So we're finding it's also kind of like a systemic issue of unfairness, to certain populations that are trying to work hard, and kind of get ahead in society. And I'm curious, like, what things do you see? Or is there any kind of encouraging or promise from government side, private sector side? Like, what are just kind of things you've seen that people understand this is a growing crisis and potential ways to address or solve it, over the next few years?
I think we're starting to address it like us. So even with some of our disaster funding, like just seeing more going into caregiving type programs, support groups for caregivers, respite dollars, which gives caregivers a break. But I think we just really need to make sure we value the caregivers in general. So even though we're asking for, we're making this conversation for saying to address that. But how about employers of even our other, our sector jobs here? So if your people, your employees, are we making policies that make it easy for them to be a caregiver for their parents or even their kids, maybe kids with disabilities, right? Any form of caregiving. Are we making even in our workplaces, outside of healthcare, like are we making
Yeah.
in our workplaces, um, where it's where someone doesn't feel like, oh my gosh, it's like a stress, right? I got to go to work. Like our policies reflecting in general that. So I think I've heard some conversations, maybe that those things are coming in. We live in a tech kind of area here in the triangle. So hopefully these newer age, companies coming in, they're recognizing that as well for their employees because people are bringing their family members here, right? They're moving their
Yeah.
moms. We have multi-generational homes now a lot, especially here in the triangle. So, you know, we need to make sure we're addressing that. So in the workplace, but I think just even more funding. I think I've even heard, like, even with our current administration, just talking about like caregiving dollars. Now, the question is, are we keeping up with the pace? with,
Yeah.
so, yes, we were talking about, but are we keeping up with the pace to make sure we're, addressing it? Because, I even before I started this field, I used to hear that quote, the silver tsunami. I don't know how,
Yeah.
people use that marker, but I'm like, I think that tidal wave hit a long time ago. And like, it's like we talk about it, but what are we doing? Are we
Yeah.
really, doing some things about it? And then making sure and I think I'm learning as I'm more in this profession, like every state is a little bit different, every county is a little bit different. And so I guess it is true. Was it your zip code determines a lot about
Oh,
what you
wow.
get.
Yeah. I hadn't heard that, but I'm going to use that now. And actually, a follow-up question on that would be if in an ideal world, if you could kind of snap your fingers and fulfill your dream of, equitable access to care, what would that look like to you?
Good question. That's a very good question. If I could snap, I mean, look, you can't throw money at everything, right? Because there's still, still things. But I think one, I commend you for this podcast. I think the awareness, like really pushing the awareness of the aging infrastructure in general, um, and and locally, grassroots level wise, but all the way to the top, like, and how we, addressing some of these issues, like, policy wise, like, once again, I know it's not necessarily just throwing money at everything because everything has a cost, right? And so as people grow, and like we said, the wages, somewhere there's going to be, you got to keep the pace with it. But are we making sure that we have programs for those, like we talked about, those in the middle? Because if we don't address that issue, like we're going to have a whole large group of people out here we're going to have, you know, people, family members, not mean it so, but they're going to get burned out. We're going to have, and then there's a lot of older adults and those aging too who are elder like orphans. They don't have family members.
Yeah.
They don't have kids or the niece or the nephew to help them. And they may be stuck in the middle. Like, so my thing is definitely on all people, but those in the middle who probably going to be a large, like you said, what, 80% from your
Yeah.
research, like we really have to like figure out a way to address that, like offer more programs or incentives or change our thresholds for that. I don't know what that magic bullet is, but 80% is a lot. That's a lot.
Yeah. That is a lot. And I guess another, as a kind of like a final thought for the listeners, I'd ask a kind of a two-part question. If there are people listening that are in this situation right now and, they need help, where would you suggest they turn to? Should they call you? Should they call the Agency on Aging? Are there other organizations that, where can people turn to for support if they need care help within their family? And then the second part of that question is if there are people listening that are just passionate about the issue and want to kind of help build a better future for care and advocate for change, are there organizations that you'd recommend to reaching out to for advocacy on policy and who's kind of thinking about this stuff?
Yeah, so at the Area Agency on Aging, so if you call us, we do have a toll-free number. And so we will try to direct you to your local provider. So usually we ask, what county do you live in? So 'cause every county is different. And then we try to connect you to whatever services are in those counties, and whatever programs there are. But for some, if you live in, like Wake County, Resources for Seniors is a good partner of ours, and they have an excellent resource guidebook that is actually what I use as my little Bible if I need to look up something for someone. But other counties have probably the same kind of structure or things, maybe not, on different scales. But if you call your area agency on aging, anyone in the state, they can probably direct you to the correct area. And as far as advocacy wise, so we do have our senior Tar Heel legislators, which are older adults who kind of advocate on the behalf of older adult issues. And so, I would say look at them and see what their initiatives are and kind of help support them. And a lot of their support is they look at some caregiving things, of course, of a lot of aging issues as well, that they go to our General Assembly and try to advocate on behalf of. So any of those things. And then if you just feel compelled and you feel like you have those letter writing skills, or use your own personal stories to contact your local, senator or representative on the state level, or even on our national level, but also our city council members and things. Look how we're designing and planning our communities. Make sure they're friendly, for older adults as well. So I think it's just being a voice in a room. Like I said, if you have your family members, be a personal testimony. That's the best way. Use your personal testimony, how it's impacting you, to share to whoever can hear it.
That's great. That's great. And I guess any final thoughts, that anything we didn't ask or cover that you'd like to share with the listeners?
No, I think, like I said, it's a great conversation. I thank you, Carrie Yaya, for just, creating a platform to talk about our caregiving needs. And so, I think as we educate people more and people see it more, and like I said, I'm getting more even from people I know in the community asking questions like, what should I do? How can I do this? So there's different programs out there. So if we just keep putting, having conversation, like I said, I think the wave, whatever that tsunami has been passed, like we really need to like be in action now, and making it affordable and accessible for people.
Yeah. Yeah, great. We completely agree. And yeah, Janisha, this was great. Thank you so much for taking the time. Thank you for sharing your expertise from all your varied career experiences. And importantly, thank you for the work you're doing at the Area Agency on Aging. It's much needed work for a lot of the families in the community that are going through this. So yeah, we really appreciate you taking the time to appear on the show.
All right. Thank you so much for having me, Neil.
Thanks.